An exclusive look at the program helping Metro Atlanta gunshot victims survive a traumatic event. This is The Six. Good evening, I'm Sean Gables.
And I'm Blair Miller. The life-saving work strives to ensure people who are shot never come back to the hospital for similar treatment. Atlanta News First Patrick Quinn is live tonight outside Grady Memorial Hospital.
Patrick, this program has an amazing success rate.
Sean, it really does. It's early, but so far in the first year, less than 1% of gunshot victims who have come to Grady Memorial Hospital this year have returned from a gunshot wound. And let's be real, we cover shootings, they're tough to cover, and then we move on until the next one. We're not going to do that tonight. We're going to focus on the victims. What happens after someone is shot? Well, here at Grady Memorial Hospital, they started this new program to ensure that gunshot victims get the care they need, both within these walls and beyond.
Shot in the back, Cheryl Mayfield was bedridden on January 13th. Doctors told her she would never walk again. 11 days later, feeling returns in her legs.
I feel that. Ooh.
And the next day,
1, 2, 3, go. Boom.
Cheryl finding her feet. By March, leg extensions.
You starting to feel it?
And we were there in October. Cheryl dropped the cane and walked.
Okay. Oh, yeah.
This is a story of recovery, yes. But through their IV program, or Interrupting Violence in Youth and Young Adults, Grady is not just focused on helping patients recover, they're working to make sure gunshot victims do not return to the ER.
We're about 9 months in, and we've had one person who's been re-injured.
One person out of 380 IV patients has returned to the Grady ER with a gunshot wound since January. Just one. That's a return rate of 0.38, far better than the national average of a 40% re-injury rate within 5 years. So how does it work? Let's start at the beginning with Cheryl.
Right, the female that said she was shot in her back.
Cheryl, a rideshare driver, said she was shot by her rider on January 13th in this East Cobb County neighborhood after the two got into a heated argument. Her rider got out. Then Cheryl heard the pop.
As soon as I hit the gas, I was shot.
Engine 1, rescue 1.
She was rushed to Grady, and that's where and when the IV program's work began, immediately.
Our team will actually meet them here at the bedside.
When we got here, I remember going into a room and it was like 12 people.
There's no victim blaming for these gunshot patients. It's about addressing potential risk factors. For Cheryl, she admits she needed to work on her mental health and anger management.
To handle things and not having to be the aggressor or show that I'm the aggressor.
But while IV's work starts in the hospital,
it does not end there.
Which brings us here.
Yes.
Grady tracks their patients back into the community.
We are building an ecosystem here in Atlanta.
2/3 of IV patients are financially unstable. They have inadequate housing or are food insecure. Grady helps address these needs, connecting them with caseworkers, legal help, education, or a better job.
Miss Mayfield, how are you?
Good.
9 months after she was shot, Cheryl broke the news.
You girl got the job.
She'll soon start working at an OBGYN clinic.
Oh, come.
Now the question, what will happen the next time Cheryl's anger is tested? Well, she said it's already happened. A neighbor recently threatened to shoot her service dog.
But my response wasn't, let me go get my gun and shoot you. My response was, let me grab my dog and just avoid that situation.
And Cheryl said that is growth. Now, bedside, clinic, community, a three-prong approach, a public health response to shootings. Right now, this program is just geared to 14 to 34-year-olds. They hope with a little bit more funding, they can expand that. And Dr. Randy Smith, who you just heard from, she said the success of this program is all credit to her team. Here outside Grady Memorial Hospital, Patrick Quinn, Atlanta News First.